at Summit Rounds this week, we had a very good discussion about carpal tunnel syndrome. Dr. Craig Chappell did the discussion, and the rounds is available in the Summit Rounds in the app. And I would encourage anybody that's interested in carpal tunnel syndrome to watch the discussion. I wanted to talk a little bit about what carpal tunnel syndrome is, how it's diagnosed, and how it is treated. So in the hand, or in the wrist actually, the tendons that go to the fingers, as well as the median nerve, go through the carpal tunnel. And basically what it is it's all the little bones in the wrist on one side, and then this transverse carpal ligament on the other. Sometimes the nerve can get swollen, and the area that it traverses through the carpal tunnel can become narrow, and the patients can have symptoms related to that. So what are the symptoms of carpal tunnel syndrome? Well, numbness is one symptom, and it would be numbness in the thumb, index finger, middle finger, and this half of the ring finger, oftentimes happening at night, oftentimes happening when the hand is in a same position for a little while. And usually the patients will shake it out and it will go away. They may have pain going into that area. And they can even have atrophy of the muscle, and that would be a late stage finding of carpal tunnel syndrome. But the numbness is very classic for carpal tunnel syndrome. And the symptoms are more common at night. Patients that have pregnancy, for example, can get some carpal tunnel because of the added swelling and fluids that occur during pregnancy. Diagnosis. This was really discussed well in the meeting. And Dr. Chappell talked about using ultrasound in addition to some questions and physical exam to see how swollen the nerve is and how much room it has. Other diagnostic tests can include a nerve conduction study, an EMG, and historically that's been a very common, even gold standard test for the diagnosis of carpal tunnel syndrome. Treatment. Patients can wear a splint to help with keeping the wrist in a neutral position at night, and that can be effective in improving symptoms. There can be a steroid injection into the carpal tunnel to help decrease inflammation. And then there's a variety of ways to decompress the carpal tunnel syndrome, or the carpal tunnel. And that's a carpal tunnel release. And some people will do that with an incision made in the wrist here, or in the palm, an open incision. Some will do an endoscopic approach, where it's a smaller incision and it's done with an endoscope. And then Dr. Chappell talked about doing it using ultrasound, and also a very low invasiveness a procedure. I've personally done the open carpal tunnel release and the endoscopic carpal tunnel release, and both are very effective for alleviation of symptoms. And by the way, Dr. Chappell mentioned that carpal tunnel is diagnosed in 13 million Americans a year. It's a very common issue, and it's one of the most common surgeries performed in the United States. If you have symptoms related to carpal tunnel, I think it's a reasonable thing to seek medical attention and to consider a wrist splint to get a good diagnostic evaluation, including perhaps an ultrasound or a nerve conduction study. And then if the symptoms are really bothersome and persistent, there are good minimally invasive ways to treat carpal tunnel syndrome. It's usually a surgery that takes about 10 minutes and is outpatient, and the patients have a very quick recovery from the operation.